Do you frequently feel like your heart pains sometimes? Or maybe your legs often swell for no clear reason? What if bruises appear too easily, or your hands turn pale and numb when it's cold? These might seem like separate issues, but they could be clues to something deeper, like antiphospholipid syndrome (APS). APS is a condition where your body's immune system gets confused and attacks some normal proteins in your blood. This mistake causes your blood to clot too easily. Imagine your blood acting like over-eager builders, laying clots where there's no need, like in your heart, legs, or even brain. These unwanted clots can lead to serious problems like strokes, heart attacks, or complications during pregnancy. But here's the good news. If caught early, APS can be managed. Does any of this feel familiar? You're not alone, and understanding is the first step. So why does your immune system suddenly start causing problems? In antiphospholipid syndrome, the root cause is your body producing special kinds of antibodies proteins meant to fight germs, but wrongly targeting your own phospholipids. Phospholipids are fat molecules attached to blood proteins important in clotting. Think of them like off switches for clotting, but in APS, the immune system sees them as enemies. Why this happens, we don't know everything yet, but some triggers include other autoimmune diseases like lupus infections, like syphilis, or even some viral infections, or even certain medicines. Genetics can play a role too, so if your mom or uncle had clotting problems or unexplained miscarriages, it might hint at a pattern. It's like a mix of bad luck in your genes plus a life event that flips the switch. Does anyone in your family struggle with confusing health issues like these? Now let's talk about how you know something's wrong. Imagine you're climbing stairs and suddenly feel chest pressure. Is it just being out of shape? Or could it be a small clot in your lung? That's possible with a PS. Common signs include repeated blood clots in legs, deep vein thrombosis. Your leg might swell, turn red, and feel warm. Or a sudden headache, blurry vision, or weakness on one side could mean a stroke, even in young people. Women might suffer miscarriages, especially in the second trimester, without a clear reason. Other clues, rashes, like a live donut-like pattern on the skin, frequent nosebleeds, or feeling tired all the time. Ever had a mysterious bruise after just lightly bumping your arm? That could be linked too. The tricky part is, these signs often look like other issues. So it's like solving a puzzle. Are these random events or parts of the same story? First, they ask about your health history like, have you had clots, miscarriages, family issues with blood? Then come blood tests. You'll need at least 2 positive tests, 12 weeks apart, to confirm APS. These tests check for antiphospholipid antibodies, the ones causing the trouble. Common ones are lupus anticoagulant, anticardiolipin, and anti-beta-2 glycoprotein 1. Think of it like catching a repeat offender on camera twice. The system must be sure. Once diagnosed, the main treatment is blood thinners, like warfarin or heparin. These don't dissolve clots, but stop new ones. Imagine putting oil in a rusty pipe. You're keeping the blood flowing smoothly. For pregnant women, a low dose of aspirin and heparin can protect the baby. But you must avoid risks: dehydration, long sits, smoking. What's your daily routine like? Could it be affecting your blood flow? Right now, we can't fully prevent a PS since it's linked to immune and genetic factors. But we can prevent its harmful effects. If you're at risk, for example family history or lupus, staying alert is key. Drink plenty of water. Dehydration thickens blood. Move regularly, no sitting for hours. If flying or working at a desk, stretch every hour. Avoid smoking. It damages blood vessels and increases clot risk. If you're pregnant and have antibodies, early monitoring helps. Also, talk to your doctor before taking birth control pills. Some increase clotting. Ask yourself, am I doing things that quietly increase my risk? Prevention isn't about fear, it's about power. Small daily choices can make a big difference. Scientists are actively learning more about a PS. One exciting area is triple positive a PS, people with all three major antibodies. Research shows they are at much higher risk, so treatment might be stronger early on. New blood tests are being developed to detect dangerous antibodies more accurately. There is also research into targeted therapies, drugs that block only the harmful immune cells, not your entire immune system. A 2023 study tested a drug called efgartigimod, which reduces antibody levels. Early results are hopeful. Another focus is pregnancy, how to better protect moms and babies. And researchers are exploring if gut bacteria affect a PS. Yes, your gut health might one day help manage this condition. Isn't it amazing how fast science moves? Could you see yourself joining this journey of discovery?